Hello, welcome to your Module 2 and Module 3 video for your CNA class. Hopefully you've enjoyed Module 1 and starting to get the feel of how this class works. This actually is going to be 2 videos because I run out of time trying to do it all in one, and it goes too fast. So make sure that you're watching both if you need that assistance. Module 2 is infection control, and Module 3 are usually done together. So please make sure you're looking at your announcements and noticing if your instructor has it together or has it apart. Each instructor does things a little bit different, but most of the time these two are done together. So please plan ahead. So if you're working when these are due, maybe you want to do them quicker or slower, but these, especially the vital signs, which is client status, Module 3, is a lot of information. You want to make sure you're taking notes during that one. Just some quick reminders. Make sure you're finishing these modules on time. You can work 1 to 2 modules ahead. Please, if you're not retaining the information, slow down. So make sure that they're due on time, but take notes, screenshot, copy and paste information. Whatever your learning style is, make sure you're doing whatever it takes for you to learn. Online's a little bit different because you don't have an instructor doing this with you in a classroom setting. So if you're having a difficult time, please contact your instructor and ask her questions in regards to what you're confused about so we can help you along the way. Our job is to make you successful at this class, and so when you get out of here, you can take the boards without any complications and pass on the first try. If you have not finished Module 1, the introduction or the syllabus quiz, please get that done ASAP. Remember, this class is done on hours, and those hours are required by the state board. Without those hours, you're not going to be able to pass the class first of all, and or take the boards. Those hours are just those are required. Okay, so even if you get a 0 on a module or a quiz, then you still need to complete it. So go back, get it done. Also, if you have not done your vaccinations or your CPR, please get that to your instructor ASAP. Remember, there's tons of ways to do that because we have technology nowadays. You don't just have to fax it. You can take it in to the nursing department and have the secretary scan that in and email it to us if she has time. If not, you can scan it in at your home base and send it to us. Or use your smart devices, your phone, your iPad, tablet, maybe even your Kindle Fire. I mean, all of us have different things, iPod. Take a picture of those documents, making sure your documents are clear and you can read them, and then emailing or texting those documents to your instructor. If you are faxing, our fax number is 382-1638. I just want to point out, if you have not done so already, go to your course information and under Blackboard and look at all the documents that we have there. Those are there to help you with this class. They help you stay organized. My favorite is the checklist. I think it shows you what's due in each module, and then you can check it along the way. I like to see that check mark. It makes me feel like I've done something in the class and I'm not just going on. It shows that you're finishing. And I'm sorry, my dog is restless. She is wandering like crazy. So here's just a screenshot of Module 2. If you notice, at the top it's the module name, the submodule name, points for each module, and then a check when you can complete, and that's where you can write that check in. I try to make a little red area just to remind you that these sometimes are done at the same time to make sure that you plan ahead. So Module 2 is called Infection Control. In that, the subunits are Intro to Infection Control, Standard Precautions, Transmission-Based Precautions, Sterile Technique, and then at the very end you have a test. So along the way you have little built-in quizzes. Each one, these are the totals for each submodule. Okay? So as you finish, we'll collect the points. So for instance, if you had 640 points out of the total of 740, we divide that as an instructor and we get 0.864. We then move over the decimal 2 spots, which would make you get 86% for this module. Remember, we don't round up, so even if you had a 0.869, which would be an 86.9%, we would not round that up. We would still have an 86%. Okay? If you are late on any of those, of course, you would get the deductions that are in the syllabus. So if you have any questions on the deduction policy, Please see your syllabus for those questions or ask your instructor. Okay, hopefully that explains what to do. Infection control is your responsibility as a CNA or a nurse or anybody that works in the healthcare field. So even if you're in housekeeping, it is your responsibility to do it. They're not going to follow you around every second of the day and remind you to put on gloves or to wash your hands. So make sure that you want to stay clean, that you're not bringing germs home to your kids or loved ones. Maybe you live with your mom or whoever. You're bringing that home. And so make sure that you're staying clean so you're not spreading illness. So it is your responsibility. Keep in mind that hand washing is the #1 way to prevent infection. We teach that to our kindergartens. Wash your hands after going to the restroom. Wash your hands before you eat. Just the common things so you stay clean and you prevent infection from occurring. Okay? I just have a quick example. If you're going into Mrs. Smith's room to brush her hair, do oral care, and peri-care, how many times do you wash your hands during that? You would actually wash your hands 5 times. You would wash them when entering the room, after brushing your hair, after oral care, and after peri-care, and then after when you're leaving the room. Remembering when it's wet and not yours that you're also putting on gloves. You're using your PPE that's provided by your facility. So you're not just going from skill to skill, you're actually putting on gloves and changing your gloves between each skill. Okay, and I did put that reminder in this quick little box. So again, I'm just reminding you, if it's wet and not yours, don't touch it. Okay, that means you're not touching it without gloves. You're putting on gloves. You're making sure you have your PPE on. Okay, you're not just not touching it. Okay, so make sure you're using your appropriate PPE for those instances and washing your hands. This is just a quick overview on isolation. Sometimes it gets a little tricky and you should know your isolation types, especially if you plan on working in a hospital setting, because then you will see isolation a little bit more frequently than if you're working in a long-term care facility. If they are in isolation, that means they have been diagnosed by a doctor with a highly contagious disease. Okay, so we're not just putting them in there as a nurse just to keep them in a certain area. We are putting them in there to keep our other patients from getting a highly contagious disease, or our staff from getting it. So make sure you're using your PPE. If someone's on airborne respiratory isolation, then make sure you're using your masks, gowns, and gloves. If they're in a negative pressure isolation room, that usually means they have tuberculosis. So make sure that you have been fitted for an N95 mask before you go in there. Okay. Droplet precaution, that is also in an isolation room. You want to make sure you're wearing your mask and your gloves and your gown for that. And contact isolation. That sometimes you might only need your gloves for that. Sometimes you might need your gloves and gowns. Sometimes you might need your glove, gown, mask, and goggles. So just be aware that you might plan ahead, know what you need on before going into those isolation rooms. You do need to know how to put on your isolation, or put on your PPE before going into isolation. So this is just a quick reminder of how to put it on. Donning means putting on. So of course, when you're putting it on, you need your gown, mask, eyewear, and gloves. And taking off, you need your gloves, eyewear, gown, and mask. Okay? So just remember that sequence when I'm going in and out of isolation rooms. And washing your hands before and after. This is just a quick reminder of in isolation rooms, we try to make sure that they always have their own supplies. For instance, if you're going in to take vitals, their vital stuff should already be in their room. And if you need to take stuff in, it stays in their room. And that is there for their length of their stay in the hospital or until they're released from isolation. Most of the time they're disposable. We throw those blood pressure cuffs and stethoscope away, or we send them down double bagged to maybe the autoclave and get sterilized. Say, for instance, you're taking out their tray, for the example. Leftovers should never be taken out. They are flushed down the toilet, and then everything is put in the garbage bag and then bagged again in a biohazard bag. We double bag everything, pillows, clothes, anything that needs to be removed from that room. So if you're doing laundry, double bag. With the outer bag always being in the biohazard bag. Okay? We're going to start on Module 3, so go ahead and click into the next video, and we'll start on vital signs. If you have any questions in regards to infection control, let us know. Go back into Health Center 21, make sure you're taking lots of notes, and studying, know your learning style. So if you have to write down the information, to know that information, write it down. If you like the videos, come back and rewatch the videos. It just goes over the highlights, remember. It doesn't go over the whole module. So it was great seeing you. Have a great module, and go watch Module 3.